is beginning over time. The health department, pays plans when they hit certain numbers. So he is, currently the old measures have been antidepressant medication management, follow-up after hospitalization for mental illness, follow-up for care for children with ADHD. But the newer measures that are going to drive the system going forward and drive the health plans, those are the people that will be funding your services as you all move from direct state Medicaid reimbursement to managed care. The new measures are looking at diabetes screening for people with schizophrenia or bipolar disorder who are using antipsychotic medications, adherence to antipsychotic medications for people with schizophrenia, and cardiovascular monitoring and for people, again, with cardiovascular disease and schizophrenia. The point I'm making is that we need to begin to think in a different way about the people we serve and begin to deal with the whole person and the health issues as well. Bill would have also said, and he has in his notes here, that what he would say to the provider community and to the advocacy community from a health plan perspective, from his perspective, is he wants you to think big, think out of the box, think about new kinds of relationships between yourselves and the health plans, come up with new funding methods. I mean, this is a time, and I think as all the plans in New York City begin to look at the HARPs and all the other changes, this is a time to really think out of the box, to come up with some different kinds of collaboration, to get away from the fee-for-service system and to get away from the long-standing hostile relationship in many cases between health plans and providers. Because if you don't work together, and that's going to now morph into my last comments about advocacy, if the health plans and the providers don't work together to come up with evidence-based guidelines, creative programs that deal with all of the needs, the social needs, the vocational needs, the self-directed needs of the population. If you don't do that, and if you don't do that well, and that means making, not only developing those programs and plans and funding mechanisms, etc., but making that clear to the policymakers in government. If you don't do that, my fear is that the premiums that will be set for the HARPs, for the managed care plans, will not have sufficient resources in them to support those kind of services. And I can say this because I don't work for government. But if that doesn't happen, I get very nervous because I think this is a time, I think managed care can, by being more flexible, by using capitation and being more flexible about how it could fund programs, managed care can be very helpful. Managed care can improve the quality of services to people and take out the unnecessary costs in the system. But this is a very, very important time of change. And if you don't do it right, you won't be able to get back to it. I was very troubled when I was reading an article in the Albany Times-Union where there was a meeting in Albany and the budget director, in response to some cuts because of the CMS issue with the developmentally disabled, talked about speeding up managed care in order to save money. Now, in the long haul, managed care will save money, no doubt about it. The record is clear. You reduce ER use, you reduce rehospitalization, of course it will save money. But that doesn't happen in year one. And if anybody says we're going to save money in year one, I worry about that. So again, it's sort of a commercial for all of you to re-engage with advocacy, but the advocacy has to be based on evidence-based treatment, on dealing with many of the issues that Dr. Mechanic so aptly pointed out. And it's a time to watch very carefully, so that as New York goes into this really grand change and grand experiment, whether it's HARPs in New York or other models in other counties, other regions of the state, it's very important that you all work to keep the system honest and to be sure that there be appropriate oversight and appropriate funding so that the kind of creative services that will really make a difference in people's lives, which go way beyond psychotropics and inpatient care or even outpatient clinical care, but the kind of services that Jody talked about. This is an opportunity to protect that, and if you don't do that, we could lose that opportunity. So that's my maybe positive, maybe negative end for this, but as the last person, I thought I'd